Good afternoon, everyone. Welcome to today's Facebook Live session. Today, on the occasion of World Liver Day, with us we have Dr. Raghuram Kondala, who is currently working as the consultant gastroenterologist at Continental Hospital. Sir comes with an overall experience of over 7 years. Sir is also an active member of American Society of Gastrointestinal Endoscopy. In light of World Liver Day, Dr. Raghuram Kondala will take us through all we need to know about liver diseases and the treatments available. Sir, can you please tell us what are the commonly occurring liver diseases?
Yeah, when we are speaking about commonly occurring liver diseases, we need to broadly divide them into two types of illnesses. One is acute liver problems, when the problem usually lasts for less than 6 months, and the other is chronic liver-related issues, where the problem lasts for more than 6 months. So in acute liver issues, we have viral hepatitis and alcoholic hepatitis and drug-related liver injury. When it comes to the chronic problems, again, viral infections like chronic hepatitis B and C, alcoholic liver disease, these happen to be the common liver problems.
Sir, what are the common signs and symptoms that one can look for?
Yeah, that's a good question. So, in acute liver-related issues, we see a lot of symptoms like loss of appetite. People complain of nausea or frequent vomiting. People develop yellowish discoloration of the eyes or urine, which we call as jaundice. Some people can have joint pains, generalized body pains, very much similar to any kind of viral infection, right? But unfortunately, when we are talking about chronic liver issues, most of the times they are asymptomatic, and people don't have any symptoms when they have chronic liver issues. Only in advanced stages, say a person has developed cirrhosis. In such scenarios, they develop symptoms like fluid accumulation in the abdomen, leg swelling. Some people can develop drowsiness, which can progress to coma. So, blood in the vomiting, so passage of black color stool. These are some other symptoms which are seen in advanced liver problems.
Okay. Sir, we're talking about acute and chronic symptoms. So, can you tell us what are the possible causes that lead to these liver diseases?
Yeah. So, acute, most commonly it is viral hepatitis due to hepatitis A and E viruses. Hepatitis A is usually seen in children and young adults, and hepatitis E is seen in older age group. And the other common issues which can lead to acute liver injury is alcohol intake when taken over a period of time continuously for many years. That can also lead to liver injury. We call it as alcoholic hepatitis. So that is also one acute condition which can lead to acute hepatitis kind of picture.
Now that we have discussed about multiple causes, sir, please tell us how can these be diagnosed?
Right. So first and foremost, whenever you see these kind of symptoms, say jaundice or anything which hints towards a possibility of liver getting involved in form of decreased appetite or vomiting, you need to consult your treating doctor at the earliest. So based on the symptoms and based on clinical signs, the doctor would recommend the next line of investigations. Usually, they would constitute blood investigations, including liver function tests, viral screen, and ultrasound scan of the abdomen. So these are some investigations that need to be done before we find out the exact cause of the liver-related problem.
Sir, for these conditions, what are the treatment procedures advised?
So, acute viral hepatitis treatment is mainly supportive. We don't have any definitive treatment when it comes to acute viral hepatitis. Drug-induced liver injuries, we need to avoid the or eliminate the offending drug which is causing the problem. chronic liver issues, hepatitis B and C, we have good treatment modalities available to control both the virus infections. Alcoholic liver disease, obviously, we need to cut down the offending agent, which is alcohol. And these days, we are seeing the non-alcoholic fatty liver disease or metabolic fatty liver disease very commonly. So if you check around 100 people, almost 20 to 25% of them, they are having this fatty liver. So this thing is usually detected on the ultrasound. And the most effective modality to control the fatty liver problem would be to aim for a weight reduction. At least 5 to 10% of weight reduction has to be aimed at, and that would lead to betterment in this situation.
Sir, what are the advanced treatment procedures that are available?
Advanced treatment procedures. Uh, so, if we want to find out the exact cause of liver-related problems, at times a liver biopsy becomes mandatory. So that can be done ultrasound guided. These days, what we are doing is we can do an endoscopic ultrasound guided liver biopsy as well, especially when there is fluid accumulation in the abdomen or other issues which prevent us from going for a routine liver biopsy. In such situations, we can go for a endoscopic ultrasound guided liver biopsy. And in advanced liver problems like cirrhosis or decompensated liver-related issues where fluid accumulation and all has happened. So some of them they would be requiring liver transplant based on their MELD score, right? So these are some of the advanced treatment modalities available. There are conditions like Budd-Chiari syndrome where reducing the liver condition becomes paramount. So in such scenarios, we can plan the procedures called as TIPS or TIPS, which would lead to decongestion of the liver.
Sir, please tell us, I'm sure our audience would want to know, considering the prevailing pandemic COVID-19, are these procedures safe to undergo?
Uh, yeah, the COVID second wave is uh, we are seeing a huge spike in the COVID cases in the recent times. So what we need to do is look at the urgency of going ahead with the investigation. So acute viral hepatitis or acute liver issues, obviously we need to evaluate them on an urgent basis because if they are not identified, if they are not treated properly, then some of them they can land up in acute liver failure. And other situations like decompensated cirrhosis, where a person is comatose or he has developed other issues like bleeding from the esophageal varices. In such situations, we need to address them on an urgent basis, irrespective of the COVID scenario. Right? But the other things which form a non-urgent kind of indications, we can always wait on that.
Right. Sir, please tell us how is the recovery of the patients after these treatments?
Yeah, so acute viral hepatitis is self-limiting in most of the cases, and with proper nutrition and proper supportive care in the form of a well-balanced diet, most of them they tend to recover. And the chronic issues like chronic hepatitis B and C, I've already discussed that we have good antivirals to tackle them. So the treatment perspective, we have good treatment options for all the liver conditions available. So the only thing when we are dealing with a decompensated cirrhosis where the problem is pretty much advanced, in such scenarios we may have to go for a liver transplant.
Sir, you just mentioned that liver diseases can be symptomatic or asymptomatic. So, what happens if liver diseases are left untreated?
Yeah, untreated hepatitis problems when they have been there for many years, say more than 5 to 10 years, then the liver consistency, which is normally very soft, it becomes hard to form, and we call this condition as cirrhosis, right? So cirrhosis is a irreversible problem, And in such scenarios, we need to address it in an appropriate manner by identifying the underlying cause and treating that.
Sir, we've all heard the phrase prevention is better than cure. So, what suitable lifestyle changes would you suggest to prevent liver diseases?
Yeah, we need to implement a VAR strategy. So VAR would mean W for weight reduction. So weight reduction is of utmost importance when we are speaking about metabolic fatty liver disease or non-alcoholic fatty liver disease. The second thing, A would be for alcohol. So if you tend to take alcohol on a very regular basis, you need to check on that, restrict the alcohol intake as much as possible. And R would mean reviewing. So after the age of 35 years, most of the times we recommend that you undergo for an annual health checkup, which includes basic parameters like thyroid profile and sugar profile. In addition to that, I would say you need to undergo a liver function test and a viral screen also, if it has not been done previously. So you need to undergo a viral screen, especially for hepatitis B and C, because if we are able to identify them at an early stage, we have treatment modalities which can keep the virus under control and prevent long-term damage from happening.
Very interesting, sir. Sir, in light of World Liver Day, what would you like to tell our audience lastly?
So now that we understand the term pandemic, I would say we are facing a pandemic of metabolic fatty liver or non-alcoholic fatty liver when we are speaking about the liver disease in particular. So the most effective way of tackling this problem would be to be aware of the situation, to understand that it's a very common situation, not to be scared about it. At the same time, we need to understand what leads to this condition. So overweight being on the higher side is the most common thing. People who have uncontrolled diabetes, they also tend to have the fatty liver. And so, and anything, an unhealthy lifestyle. So more of a sedentary lifestyle, lack of physical exercise. These things they tend to precipitate this condition. So once you identify any of these situations, try to rectify them and try to help the treating community in tackling this pandemic of metabolic fatty liver disease.
Thank you, doctor. Thank you for your valuable time and for giving us an overview of the liver diseases in a very effective way. Dear viewers, you can drop your further questions in the comments so they can be answered in the future. To book an appointment with Dr. Raghuram Kondala, you can click on the link provided in the description or contact us through the information provided below. Thank you, sir.
Thank you.
Thank you.